So let's learn about acute otitis media. What is acute otitis media? You know what is otitis? Otitis is the infection, okay, media, infection of the middle ear. So now the question is infection. Where this infection comes? Does it come from external ear or from internal ear or some other pathway? So the answer is some other pathway. So the other pathway is eustachian tube. You know what is eustachian tube? It is a connection between the middle ear and the nasopharynx. So obviously you just think, if you have pharyngitis, here is your pharynx, you have pharyngitis inflammation, infection of the pharynx. Okay, obviously most pharyngitis is mostly due to the bacteria, and the bacteria is Streptococcus pneumonia. What happens is this pharyngitis starts spreading to the eustachian tube. Okay, so how this process leads to acute otitis media is the question mark. So it has 3 stages. The first stage is tubal obstruction, which eustachian tubes gets obstructed. How it get obstructed? See, the bacteria, due to the pharyngitis, the bacteria may move to the eustachian tube. They may cause infection, inflammation, bacterial superinfection can happen. You know, inflammation, what does inflammation leads? You have seen in your pathology, right? Inflammation leads to edema. So here what happens? Edema formation. The first stage is tubal obstruction, in which edema starts forming. So edema is formed. Now eustachian tube is blocked. Okay. When eustachian tube is blocked, you know this is tympanic membrane, right? So यहाँ पे ब्लॉक हुआ है सारे eustachian tube. यहाँ पे the air is coming, negative pressure is created, so the tympanic membrane gets retracted. Okay, it gets retracted. This is first stage. The second stage is called as hyperemia. What is hyperemia? Then पूरा यहाँ पे inflammation of पूरा walls, all the walls of the middle ear gets inflamed due to the bacteria, and due to the inflammation, the exudate, the vascularity increases. There is exudate starts forming. All the exudate starts forming in the middle ear. Due to the formation of exudate, there is ear pain, and most important is cartwheel appearance. You can see the cartwheel appearance of the tympanic membrane. Radially running vessels can be seen. Okay, which is a diagnostic for seeing that there is acute otitis media. Stage 3 is suppuration, where pus, due to the bacteria, due to the exudate, pus formation takes place. I think I'm making it so dirty, but it's okay. I hope you are understanding it. The pus formation takes place. Due to the pus formation, there is maximum pressure on the tympanic membrane, and tympanic membrane starts bulging. Can you see? It starts bulging. Okay, that is due to the pus formation here. There is maximum pressure on that, and it starts bulging. Due to which, due to pressure, you know, tympanic membrane, and pressure on the membrane leads to. So due to the pus formation, the tympanic membrane bulges. So there will be more pain, more site of pain and discharge. The tympanic membrane can also rupture, and discharge may also be produced. So here you can see a lighthouse sign, that is pulsating otorrhea. You can see the lighthouse sign is seen in third stage. Hope you understood the concept of acute otitis media. Let's understand its management. How you will manage? First, it is causing due to bacteria. Let me give antibiotics. It is mostly due to Streptococcus pneumonia. I can give penicillin. I can give benzyme, penicillin, amoxicillin. These I can give. Then decongestant. Why you are going to use decongestant? Edema formation. Okay, in the first tubal obstruction, there is edema formation. To relieve the edema, you are going to give decongestant. Then you are going to give analgesics. The pain relief you are having due to the pressure of the pus formation, there is pain, so you are going to relieve the pain. This is how you manage when there is severe pain, when there is congestion, when there is cartwheel appearance, when there is slight bulge, you give antibiotics, decongestant and analgesics. When you see start bulging of tympanic membrane starts bulging and there is impending rupture, then you have to go for myringectomy. How you have to proceed to myringectomy? This is important question. How you do it? See, you have to make an incision. The question is where to make an incision. Surgically, where to make an incision? You have to make it in posterior inferior quadrant. Posterior inferior quadrant. Okay, why posterior inferior quadrant? See, if you go, this is anterior of your tympanic, this is posterior of your tympanic. If you go for posterior superior quadrant, there is risk because there is a oval window, there is a facial nerve, there is a incus. Okay, in anterior surface also you have many important structures. So best is you have posterior inferior surface, and you should never give the incision in straight line. You must give it in curve. Why you are going to give in curve? If you give in straight line, all the exudate must come out. Before coming of exudate, if you give it in straight line, the tympanic membrane starts healing by itself. So if you give in curve, it takes time to heal. So you can remove all the exudate. Okay, this is how you have to manage the case of acute otitis